Hi and welcome. My name is Thyne and today I'll be doing an oral presentation on a specific client that visited me in clinic. A 25-year-old female client came into the clinic with the main goals of wanting to improve her reproductive health and aiding her digestive complaints. The client mentioned that she had recently had an abortion surgery 2 weeks prior to the consult and was 11 weeks pregnant when the procedure took place. With further investigations on the client's digestive system, the client expressed that she was suffering cramping, constipation, and excessive amounts of flatulence. The client stated that it feels like she can't eat due to sharp stitch-like pain in her lower left abdominal. She has no appetite and passes a stool once a day, depending on how much she eats. 2 out of 7 days she feels a complete and satisfied emptying. When pregnant, she struggled to pass stool easily. Bloating is all over her stomach and is uncomfortable after eating. No particular food was indicated. Her stool stinks with mucus present as a light brown colour. She experiences brain fog if she does not eat and craves salty food, and has flatulence is increased when she is bloated. Her abdominal pain was at its worst, a 10 out of 10, straight after her abortion surgery, and she thinks that it was a reaction to the anaesthetic. The client mentions that when she eats more fibre, it helps relieve the pain and the constipation, such as from fruits or vegetables. And if she drinks low amounts of water, less than 1 litre a day, it can make it worse, making her stools harder to pass. We further investigated her female reproductive system. The client had a surgical abortion 2 weeks ago. Her menstrual cycle post the pregnancy was regular every 28 days and still hasn't had her bleed back since the abortion. The abortion happened at 11 weeks along pregnancy, and she is currently spotting. Cramping, tenderness, and pain is present in her ovaries and uterus at 6 out of 10, and she also experiences hip and back pain at 8 or 9 out of 10, to the point where she feels like she can't stand up. Her neurological system, she experiences stress 5 out of 10, and everyday anxiety 8 or 9 out of 10, with a GAD-7 score of 10. She says that her anxiety comes alongside her stress, which is related around work, overthinking, when she spends time alone, and the doctors did suggest her to go on antidepressants, but she did not want to take them. Things that also help her are calming music, slowing down, cleaning her room, and she, upon waking, experiences a headache within the first hour. The client's personal history is as shown on the slide. Birth to 5 years, she was bottle fed and in and out of hospital. 11 to 6 years, she had violence within her family and was put on the street by age 10 and then moved in with her great mother. From 12 to 17, she states that she supported herself from 16 years old with having mental issues in forms of an eating disorder such as anorexia and body dysmorphia. From adulthood, she recognizes that she was in a dark place 2 years ago and proceeded with trauma therapy, of which she notes helped. She also experienced kidney infection within the last year and frequent UTIs. She indicates that she may have low iron and also experienced abortion surgery. Her overseas travel includes America, Canada, and New Zealand. Family history. The client's family history covers, on her father's side, her grandmother had breast cancer, and her mother has an underactive thyroid, and grandfather prostate cancer, and grandmother kidney failure on her mother's side. Social and lifestyle factors. Currently, the client walks 3 to 4 kilometers every day. Previously, abortion walked 12 kilometers 3 times a week, with running or Pilates 3 times a week. She has a history of being a child athlete in rowing and doing Ironmans. She goes out every weekend for drinks with friends and always ends up being a late night, getting to sleep in the AM or not at all. She takes cocaine and MDMA because everyone else is doing it. She has been on a vegan-vegetarian diet base for the past 10 years. She mentions her energy levels are a 5 to 6 out of 10 in the morning, but it's hard to get out of bed. Her energy picks up after her morning ritual of a large coffee to an 8 or 7 out of 10 and drops around lunchtime to a 3 out of 10. while she experiences brain fog and lacks concentration skills. She says that eating a banana helps. Sleep hygiene. She is in bed by 10 to 10:30 and goes to bed feeling stressed and exhausted most nights of the week. She wakes up at 4 a.m. for work. In total, that is a 6-hour sleep at night. The client considers work as a high-stress job and is thinking of recently quitting. The biomedical diagnosis of post-abortion care, constipation, high stress. The pharmacological interventions for post-abortion care, as stated by WHO in 2019, state that no medical follow-up is required post-abortion, and follow-up is optional to discuss management of complications, side effects, or contraception options, as well as education. The pharmacological interventions for constipation include medications that draw liquid into the intestines to speed up peristalsis, such as laxatives, fiber increasants, stimulants, osmotics, lubricants, and stool softeners, as well as lifestyle and dietary changes are also investigated, such as increasing exercise, increasing whole foods in diet to increase fiber intake. Pharmacological interventions for stress are sedatives, antidepressants, beta blockers, as well as referral to psychotherapy. Showing energetic states of height and excitatory with overstimulation and overactivity of the adrenal response due to high demand work life, going out past midnight every weekend, restlessness, lacking concentration, and an overactive mental state, expressing overthinking and high stress linking to anxiety. She's also experiencing wind and tension energetic stage, such as bodily expressions of tension, cramping, constipation, flatulence, and issues relaxing and unwinding. To holistically look at the client's presenting complaint, the client has a deep history of traumatic family-related events that have greatly affected her upbringing, causing alterations in the client's stress response cascade, due to her being flown away from her family and bringing herself up since she was 16 years old. This has resulted to the client to lack self-compassion and love, resulting in mental health issues and self-image complications. Currently, the client lives a high-stress lifestyle with no room for rest and recovery to take place. She is not prioritizing herself in terms of eating frequent meals, supporting her body to recover from abortion, and no rest preventing her from the full recovery from this life event physically, mentally, and emotionally. Due to continuing a fast-paced lifestyle, drinking and drug use, high caffeine use, and a low intake of vital nutrients and minerals is causing the client's energetic state of hot wind to be exacerbated and preventing healing. Cure are time management and commitment to the protocol. Changes in lifestyle, such as not going out as much, getting into bed before 9 p.m., implementing a self-love daily, in any form that comes natural to the client, seeking out extra support such as psychotherapy. Ways around the obstacles to cure include carrying her herbal formula with her, educating the client on the benefits and reasons of why she is seeking assistance with recovery and well-being and how she will achieve it. Energetic considerations of the patient, with consideration of her low vitality, stress 6 out of 10, and anxiety 8 or 9 out of 10. Her pale eyes, skin, and tongue indicate nutrient deficiencies and her hot and wind energetic states. Consider that the client is expressing a low vitality. Patient-centric treatment priorities. To restore and mend the reproductive system post-abortion through female tonics. Assist mental emotional states through her nervous system support. Monitor and regulate bowel motion to decrease constipation and pain, as well as improve detoxification pathways. Short-term treatment herbal aims. Nourish and support the reproductive tract to heal and mend damaged tissue due to abortion surgery using female tonic, spasmolytic, immune modulating, and anti-inflammatory herbals over the next 2 weeks. To heal intestinal permeability, to reduce GIT pain and bloating, increase nutrient absorption, and support the gut-brain axis with the use of anti-inflammatory, tonic, spasmolytic, and sedative herbal medicines over the next 4 weeks. To support the HPA axis to reduce symptoms of stress, anxiety, and depression through herbal adaptogens and sedatives over the next 4 weeks. Improve detoxification pathways by regulating bowel movements and the use of herbal adaptogens to stimulate the vagus nerve, activating the parasympathetic nervous system to enhance colonic motility over the next 4 weeks. Long-term treatment aims. Further regulate the HPA axis to prevent adrenal burnout and manage symptoms of stress and anxiety from a 9 out of 10 to a 4 out of 10 over the next 3 months with the use of herbal adaptogens and sedatives. To support her female reproductive tract to bring her back her regular menstrual cycle with the herbal formula tonic over the next 3 months. the herbal prescription is as followed: Verbena opulus, Angelica sinensis, Rehmannia glutinosa, Alchimilia vulgaris, and Withania somnifera. Viburnum opulus, common name crampbark, has shown in vitro studies to have spasmolytic, antioxidant, anti-inflammatory, estrogenic, and cytoprotective properties due to its bioactive components such as phenylatic compounds, vitamin C, carotenoids, iridoids, and essential oils. Traditionally, it has been used as a uterine sedative and uterine tonic, where a predisposition for miscarriage and abortion is in place. It was also used as a Pardis preparator and has a strong antispasmolytic properties, therefore is highly indicated for cramps within the uterus, which is highly indicated for this case. Specific actions for this case include spasmolytic, anti-inflammatory, antioxidant due to cramping, pain, post-surgery, and uterine tonic, as well as the energetic states of bitter and cooling. Angelica sinensis, common name donquai, has been used traditionally referred to the empress of herbs and is used to move stagnant blood and comfort the womb. Currently, it's used to elevate issues associated with menstruation and menopause due to its vasodilating spasmolytic effects. It also acts as a smooth muscle relaxant and is recommended in headaches and migraines. Its main actions that are specific for this case include anti-inflammatory, anti-anemic, uterine tonic, and laxative. Angelica sinensis' key constituents that support the actions include essential oils, ferulic acid, coumarins, and phytosterols. Was traditionally used in the Chinese medicine herb to nourish the yin and invigorate the kidneys. It was also understood to remove heat from the blood and improve proliferation of stem cells. Rehmannia is mainly used as an adaptogenic actions and its interactions with regulating HPA axis, inhibiting cortisol levels and regulating thyroid hormones, which is highly indicated in this case to support the client's high stress and anxiety through nourishing the nervous system and improving the adaptation to stress. Studies have also found that Rehmannia acts as a mild laxative and is indicated in constipation, of which is another action specific for this case. Key constituents of Rehmannia include iridoid glycosides, Rehmanniosides, and Rehmannia glutens. Alchimilia vulgaris, commonly known as lady's mantle, has been traditionally used to mend connective tissue, making it specifically helpful in wounds of the female reproductive tract. This is one of the main reasons lady's mantle was chosen for this case, due to the post-abortion care in mending the torn tissue. It also acts as a nerve and has been used for the treatment of anxiety, which is also another indicator for this case. Key constituents to support the actions are L-argintannins, flavonoids, and phytosterols. Withania somnifera, traditionally used for asthma, diabetes, stress, cancer, and hypertension, is now widely researched and used as an adaptogenic, anti-inflammatory, and general tonic. Scientific evidence shows that Withania is a potent adaptogen of which improves cognitive function and improves the immune system, all of which is highly indicated for this case. The adaptogenic activity of Withania is due to its key constituents of cyanosides and steroidal compounds. Other main actions of Withania that are specific for this case include general tonic, mild sedative, anti-inflammatory, immune modulating, and anti-anemic, with the potential of an iron deficiency within this case. With compliance, the main outcomes the client will experience is nourishment through the support of the reproductive tract, increasing healing time, and reducing of inflammation, pain, and cramping and spasming. The client should experience a greater ability to handle stresses, finding that her stress response has strengthened, making her adaptable to stress due to the chemical improvements within the HPA axis. A reduction in constipation and bloating through the mild, laxative, bitter, and anti-inflammatory and general tonic actions of the Herbal formula. For increase of energy, it is to be predicted due to the energetics of the Herbal formula working synergistically together to cool the client's energetic status, as well as providing loss of nutrients and minerals through the herbal constituents. These are the references.